Benzene poisoning. Benzene poisoning has a long history. Somebody may think benzene equals cancer, and it has an environmental alert. It is an important commercial commodity, though it become widespread in different countries, and you may find it in different industries. We will introduce benzene poisoning with case study. This is a 50-year-old man. He is a diesel mechanic, and he visited your office because of a nosebleed for 2 days. And he says this is not the first time he has nosebleed. 6 months ago, he has nosebleed, and this is a third episode. He expresses concern that he becomes easily fatigued at work. And 2 months ago, he began noticing bruisings on his arms and legs. So, besides the nosebleed, he also has a fatigue and bruisings on his skin. Another one is he has lost more than 12 pounds in the last 2 years. This is another long time. That is 2 months ago, he found he loss of appetite, and then he lost more than 12 pounds in the last 2 years. Now, we knew this patient has nosebleeds, fatigue, weight loss for quite a long time, and his symptoms is not an emergency symptoms. They has a long history. The weight loss even has 2 years. And besides the history, after you knew it, you do more physical examination and find he has a coughing and breathing problem, and you do more laboratory studies and find out more problem with this patient. And after you read this case, you may think 3 questions. What's the problem list for this patient? And what's the differential diagnosis? And what additional testing would you recommend? And what measures would you take to manage the case and treat the patient? With these 3 different questions, you may think more about this patient and do more investigation. And because this is a diesel mechanic, he's a diesel mechanic, so it can expose to gasoline with different chemicals. So benzene, the exposure pathways for the benzene is vary. And first we have to know what is benzene. Benzene is a chemical that is a colorless and light yellow liquid at room temperature. Because of its colorless and light yellow liquid, you may not easily find benzene in the industry by the color, but benzene has a sweet odor, so you can smell it in your working place. And it also is highly flammable, so don't let the light get too close to the benzene. It may make the benzene bomb. Another characteristic for benzene is benzene evaporates into the air very quickly. So you can exposure to the benzene, and the benzene can go into your body through breathing. And benzene, its vapor is heavier than the air, so it may sink into the low-lying areas. For example, in your working place, the benzene can stay in the air because it can evaporate into the air very quickly. And you may also exposure to the benzene from the desk, floor, and something lower lying areas. So when the workers clean the industry place, clean your working place. If they brush the floor or they wipe the desk, the benzene on the lower lying areas may evaporate into the air again, and you may absorb the benzene again through the breathing. So, when the workers clean the floor or the desk on the working place, they may use water. But benzene dissolves only slightly in water and will float on top of water. So we can't wash benzene away with water, but with the water, benzene can get heavier. It won't go into the air again, and it will decrease the chance for the workers to breathe in the benzene. So this is exposure pathway for the benzene. And benzene, why we can find it commonly in a different industry? Because benzene is commonly used as a solvent and as a raw material in chemical synthesis. So benzene can be easily found in different industries. And benzene is also a component of gasoline. It is widespread in the environment. So besides the working place, we may also find benzene in our daily life. Benzene is found from both natural processes and human activities. So you can find benzene from volcanoes and forest fires. It is also a natural part of crude oil, gasoline, and cigarette smoke. So think about this patient's job. He is a diesel mechanic, so it may exposure to gasoline, and the gasoline may contain benzene. And later, the patient in a case study tells you that his well water has always tasted funny and smells like a solvent. And after investigation, you find a chemical plant was quite close to his house until 9 years ago when the company moved to another location. So you take the patient's well water back to your laboratory and do more analysis and find benzene and other chemicals in his well water. So besides his job, you may concern this patient may exposure to benzene in his daily life. So we know two different exposure ways for this patient. And what areas will you explore?